My name's Mary, and my project is going to be about coronary artery bypass grafts, which is a type of surgery. So, what is coronary artery bypass grafting? Basically, this type of surgery is used to improve blood flow to the heart when there's like a blockage in an artery. It's for patients that have advanced CHD or coronary heart disease. Coronary heart disease is a disease in which plaque builds up inside the arteries and they can create a blockage causing a heart attack. The surgery is called CABG for short, and there's lots of other names like bypass surgery, open heart surgery, or heart bypass. And although CABG is a treatment for CHD, it's not the only one. You can make lifestyle changes, have medications, or coronary or angioplasty. So, who would need a coronary artery bypass graft? Basically, it's for people who have coronary artery disease, and it's helpful during or after a heart attack, and it's used for people to treat someone who can potentially have a heart attack in the future. And you can have symptoms and it depends on how severe the blockages are and other problems. And if you look at the image on the slide, it shows that the plaque can literally block the entire artery, which can eventually lead to a heart attack. And left untreated, that can lead to death. So a patient who qualifies for CABG is those who have the large blockages of these arteries, and it's also relevant if the heart pumping is growing weaker and it's putting a lot of pressure on the heart, and if you have a blockage that can't be treated with a PCI. And if you look at this image, it shows that you get a vessel from your arm or leg, and you use it to create a different route of blood flow. So there's different types of CABG surgeries, and there's one where the chest bone isn't fully opened, and there is ones that the heart isn't stopped during the procedure. And so these are different types of surgeries, and it depends on where the blockage is or how severe it is, and in the way that they can treat your blockage. So how do you diagnose and have someone get this surgery? So basically there's different tests your doctor can do, physical exam, listening to your heart, your lungs, your blood pressure, your heart rate. If you have the history of disease in your family, they can do an EKG or an electrocardiogram. This detects and records your heart's electrical activities and can detect irregular heartbeats, the strength of electrical signal of your heart, and it can detect if there's heart damage due to coronary heart disease. Your doctor can run a stress test, and that measures heart output while under stress of exercise. They can do cardiac catheterization or coronary angiography, and these are two tests that use dye to see the insides of your arteries, or inserting small tubes like catheter into your blood vessels and checking if there's blockages. Echocardiography or echo is a test, it's a sound wave exam, and it creates a moving picture of your heart, and this can show the size and shape of your heart and the chambers and the valves. I mentioned earlier PCI, so this is percutaneous coronary intervention. It's a coronary angioplasty. This is a non-surgical procedure that a stent is placed into your coronary artery, and the stent mesh, it has a mesh tube that supports the blocked artery, or it supports the artery from collapsing, if you were to have a heart attack or if you have a severe blockage. Now, the process of having the surgery is the chest is open through an incision, and the heart is stopped through medication, and the heart is put on it's a heart-lung bypass machine, and this keeps your blood flowing and the oxygen moving throughout your body during the surgery, and this will allow for the surgeon to perform the surgery and make the repairs while your heart is still, so it's easier. And so after the surgery is completed, the heart will start beating on its own, and if not, sometimes electrical signals are given. The goal of this surgery is to improve quality of life and to lower the risk of having a heart attack, and improving the chances of survival if you had already had a heart attack. Now, after surgery, the recovery is usually 1 to 2 days in the ICU, and you get an IV with medication and a chest tube to drain the fluid in your lung or in your chest cavity. And then there's recovery at home, and Side effects can go away from 4 to 6 weeks, but full recovery is in about 6 to 12 weeks. Now, the success rate for this surgery is excellent, and you can remain symptom-free for 10 to 15 years, and it can lower the risk of a heart attack.